Hey, welcome back, Bio30S. Today we're going to be starting off on our first organ system. This is our second unit, and from here on forward, we're going to be looking at various different systems that operate to help our body maintain homeostasis. Today's topic is going to be digestion and nutrition. As you can see, digestion and nutrition, as you can probably figure out as well, it's one that we can relate to, but it takes up a large number of pieces in our body. You can see that it starts way up in the mouth and it goes all the way down into this very large region in our abdominal cavity. And there's a number of different pieces here that are involved. Yes, absolutely. You do have to remember and understand what each of those are. If I was to give you a picture, you'd be expected to label and recognize each of these organs and organ parts. You also have to recognize what each of them do. But that gets overwhelming looking at an image like that. So we're going to go through it piece by piece and try to understand how this whole digestive system works. So we're going to start off by talking about the digestive tract. This is this big long tube, and it starts from your mouth and ends at your anus. Really thinking about it, our digestive tract is just one long hole. So it starts at our mouth, it comes out at our anus, and essentially you could tie a piece of string in one end and it would come out the other end. Um, that's just how the digestive tract is. Now, obviously, there's some things that happen in between, but the tract itself is one long opening. What the digestive system is going to do is going to ingest food, so that's getting food into our bodies. We're going to digest it. So digesting it allows nutrients to cross over the membranes in our cells. And then we're also going to be absorbing all those nutrients that our body can use. So depending on where the body needs the nutrients and what kind of nutrients we need, and then also what kinds of foods we're eating, that's going to be influencing the nutrients that get in. The last thing is that our digestive system should also be able to eliminate things that we cannot work with. So any kind of waste that we have, anything that is indigestible, typically our body should be able to eliminate that. There's some exceptions. There's some products that we can't eliminate, which causes problems for us. But if we can eliminate them, then we will. There's two different things that are going to happen at the exact same time. There's what we call mechanical digestion. This is usually the larger pieces of food, and they become smaller by just basically beating them down and crushing them. You can probably relate to this most easily in your mouth because you're chewing and you're moving food around with your tongue, so you're breaking it into smaller pieces so it fits down into your throat. But this happens in other parts of your digestive system as well. Your stomach, for instance, is bouncing around, it's rumbling, it's breaking things down that way. And the rest of your digestive tract is also moving through a muscle layer as well. So lots of mechanical digestion that's happening. We've also got what's called chemical digestion. Chemical digestion is something that you might relate to better from your stomach with the stomach acids. So when there's enzymes that are there to break down the food, that's typically what we talk about when we think about chemical digestion. But that actually starts in your mouth, just like mechanical digestion. You've got chemical called salivary amylase, which we'll talk about later, which immediately starts to work on different food types that are in your mouth. It converts them into sugars. That's why if you take a slice or if you take a small piece of bread and you just let it sit on your tongue, if you let it sit for a couple of seconds, eventually it starts to feel sweet because you're breaking it down to the sugars. So during chemical digestion, there's a whole whack ton of enzymes that our body is going to be using. Enzymes, in case you're not aware, they're specialized chemicals that increase the rate of a reaction. So a reaction is, if it's going to happen, it's going to happen, but it might take a really long time for food or products to be converted into a different type of product, but an enzyme is going to speed that process up. And that allows us to actually have an efficient system that we can work with. So we're going to start right up at the beginning, right at the start. And the first area we're going to be interested in is the mouth. So the mouth, that's with your, it's covered by your lips and it's within your cheeks. You know where your mouth is, right? You've got a hard and a soft palate that allows you to separate your mouth from your nasal cavity. Otherwise, your mouth and your nose would be the same thing, and that'd be kind of gross. There's a couple of salivary glands that are in your mouth, and they allow saliva, which contains that salivary amylase, into the mouth. So when you're hungry, you produce this more. If I show you pictures of food or talk about food or you smell food, your mouth starts to produce. You start to have a watery mouth. That's your body producing saliva and preparing you for chemical digestion in your mouth. At the back end of your mouth, you've got what are called tonsils. Tonsils are there to protect you against infections. So something gets into your mouth that's not supposed to be there, you have a reaction almost immediately to eject that from your body. And then right in the back middle of your mouth, I'm not going to show you because I don't want to open my mouth on camera, but right at the back, you're going to have what's called the uvula. It looks like a punching bag that sits at the back. Some people have very sensitive uvulas. Like if you get anywhere near it, it's going to cause you to gag. Other people are able to suppress that reaction, but that's back there as well to make sure too many unwanted products don't get into your mouth. So it's essentially we don't want food to go into your nose, right? So your nose and your mouth do eventually connect later on deep in your throat, but theoretically, if they combine, instead of food going down one way, it's possible food will go the other way. You might have seen this happen before too, when people, especially with fizzy drinks or gassy drinks, if you make someone laugh when they've had a sip of something, they might be laughing so much that the air pumps that fluid back into their nose and then it comes out their nose. It's really gross, but it's just demonstrating that they're both connected. The uvula is there to hopefully prevent that from happening. Okay, so it's just a quick image of what the mouth looks like. Get your hard palate up at the top, soft palate a little bit later on that connects to the uvula, which is at the back. And on the back ends here, you have tonsils. Tonsils tend to be sticky with certain foods. So if you're a dairy consumer or you eat lots of cheeses, it's very common that cheese might stick to the tonsils, or cheese product might stick to the tonsils. So it looks like there's like these white specks in the back of your throat. You've also got what are called molars, premolars, canines, and incisors. We're going to talk about those as your teeth shortly as well. So, as mentioned, you have various different types of teeth. You might also have a wisdom tooth at the back. Some of us have it, some of us don't have the space for it, or some of us haven't had our wisdom teeth come out. It's just an evolutionary tooth that we don't need for the size of our mouths, so we don't typically worry about those too much. Our teeth are going to help us with that mechanical side of digestion. So they're going to break pieces of food into smaller pieces. The front teeth are going to rip them apart, and the back teeth are going to smush and crush them so that they're smaller and a little bit easier to digest. During the first couple of years of your life, there's a couple of baby teeth that are in your mouth. Eventually, those teeth are going to be replaced by all of your adult teeth. So those small teeth, they just sit on your gums, and then once the adult teeth are ready to come out, they pop those baby ones out. Your adult teeth are very long; they go into your gums, so they're not expected to come out unless there's like severe trauma or damage that's happening. You have two different parts for each of your teeth. At the very top, you have what's called the crown. That's a layer of enamel. It's very, very hard, and there's various calcium compounds that are there to make it hard. So it's kind of like an eggshell. You've also got what makes up the crown. So dentin is this bone-like material, and then you got the inner pulp. This is on the inside of the tooth, and this contains all the nerves and the blood vessels. If you got holes in your teeth, or if you don't have as much or very strong enamel, or you just have sensitive teeth, what's happening is that that signal from or that sensation that you're getting from, say, hot or cold foods or beverages, that is going through the actual tooth and interacting with the nerve in the inner pulp. And then you get some sort of sensation for that. Depending on who you are, it might be a pain, it might be just a tickling sensation, it could be any sort of feeling. But if you get that kind of feeling with cold or hot fluids or foods, it's probably because of sensitive teeth. You should get your teeth checked on a regular basis, though, because it could be a sign of a cavity forming. It means that you have a soft part of your tooth that's being broken down, and so that enamel is being eaten away, and you have very sensitive teeth. At the bottom of your teeth, the part that's into your gums is your root, and your root is in this bottom portion over here. So you have this little space that goes down into your gums. So your enamel's at the very top, and then you got this dentin, which is this hard structure behind it, and this whole top piece is what's called your crown. So that's the part you see when you see someone's teeth. You can see that their enamel, their crown is showing. But as a person eats, depending on what their dental hygiene is, this part can get damaged over time. So what cavities do is they actually soften parts of this enamel, and they start to bury into this pulp area, or this dentin, and then eventually into the pulp area. If it doesn't get to the pulp, then you can get that replaced with a filling. That's what you'll have to do when you go to the dentist. They put a filling in, so they chip off all that cavity, and then they cover it with a material that is similar to your tooth, and that prevents the cavity from going any further because you've removed it. If the cavity isn't looked at or isn't taken care of, It actually burrows into the pulp area here, and then that's when it gets very painful. That's when you start to have pain because of your nerves that are in here, and you can see the nerves go out of the tooth and then into your skull. So if that happens, you have to get what's called a root canal and basically get this whole part removed. But that's extremely painful because you're dealing with the actual nerve at that point. A couple of bits of information about your teeth. There's a couple of things that you can do to improve the strength of your enamel. Fluoride treatment, for example, does this. So, if you've ever been to the dentist and they put that foam in your mouth that tastes like pineapple or bubble gum or whatever it is, and it's like this light foam, and you have to just leave it in your mouth for a couple of minutes. You're not allowed to spit. They give you a little cup just in case some drool comes out of your mouth. That is fluoride. Fluoride, not fluorine. Fluorine is something totally different. Fluorine will kill you. Fluoride is okay. Fluoride is the stuff that might be trace amounts in your water, and that's actually okay because when your teeth absorb fluoride, it's improving the enamel. So that's really good. When you brush your teeth, even you shouldn't. Well, you should always spit after brushing your teeth, but you shouldn't rinse your mouth right away. You should give your mouth about 60 seconds or a little bit longer, and that gives that fluoride from your toothpaste to get properly absorbed into your enamel as well. Otherwise, you're just washing it off right after you put it on, which kind of defeats the purpose of toothpaste. At that point, you may as well brush your teeth without any toothpaste, which isn't also like that's not a bad idea. As your gums get a little bit older, they might start to get swollen. That's called gingivitis, or you might get something called periodontitis, which is a little bit more of a serious situation. But with proper dental hygiene, you don't have to worry about that so much. If you want to read about the types of teeth later on, there's some information here about the incisors, canines, premolars, and molars. I'm not so interested about those in particular, the types, but in case you're curious, it's there. Next up, we got this floppy fella called the tongue. Your tongue is going to help you mix up the chewed food that you have with saliva. You want lots of saliva in your food. It makes it more liquidy, which is easier for you to digest and break down. And if you have more saliva, you have more salivary amylase. Um, when you're brushing your teeth, just as an FYI, you should be brushing your tongue as well. Your tongue should look like this. If you got cracks on your tongue, or if you have especially white on your tongue, that means that it's starting to become a breeding ground for bacteria. And bacteria will start to stick to your tongue. You got this white mixture on your tongue. You'll be hiding in your cracks as well. That leads to things like bad breath and can influence other oral health care issues. So when you brush your teeth, you should also brush your tongue and make sure you're brushing off some of that white stuff. If you do have white stuff on your tongue, you'll have to brush. Like it's not going to go away in one brushing, but if you do it over a couple of days to a couple of weeks, then eventually your tongue cleans up and it's nice and pink. That's the color it should be. When you do mix your chewed food with saliva, it gets into this really gross mass in your mouth. Little kids, like kindergarten kids, might like open their mouth and be like that, and they show you what it is. That's a bolus. Okay, so it's no longer food at this point. We call it bolus, and a bolus is something that you can swallow. And when you swallow it, you're going to send it into the pharynx. So once you get the food to a certain point down into your throat, there's a reflex in your pharynx that allows the food to come through. You don't have to think about that. Food gets to that spot and it actually just goes right down because it's a reflex. Food gets there, it goes down. And we call that swallowing. So during the swallowing, the soft palate, that's the soft part behind your uvula, it's going to move back and it's going to close the nasopharynx, and it's also going to close up the trachea, which is your windpipe, because you don't want food going down into your windpipe. That trachea moves under this other structure called an epiglottis. Epiglottis is to cover up that opening there. And then it also covers up using the glottis, the larynx, which is your voice box. Now, larynx is really cool. It's like if you ever strummed a guitar before, there's strings in there, and you strum a string and the vibrations cause sound. You have one of those in your throat. That's your larynx, and that allows you to have a unique voice. We'll talk more about that, though, when we get to the respiratory system. So just so you can see what it looks like, there's your hard palate right over here. Right at the back, you have your soft palate. So your mouth is down over here. This is your tongue. You can see it's a very large mass, but it's very flexible. And then the bolus, this is that brown mass back here. So you've eaten something, it becomes like just a clump of gooey, liquidy, whatever it is. And on the front side of your throat, you have what is called your trachea. And on the back side, you have what's called the esophagus. And you want the epiglottis, this fold of skin, to cover over your trachea because you don't want that food getting into that part of your throat. If it does, then it might interact with the larynx. It usually causes you to cough if something gets stuck in here. The bolus should come right down into your esophagus. Also, that uvula, that droopy thing that's in the back of your throat, it's soft because when you do swallow, it actually covers up this nasal passage up here. So that way you don't have any food coming back into your nasal passage. But like I said before, if you make some, don't do this, it's mean, but it's also pretty funny. If you make someone laugh when the food is down in this region, that means air is coming out of their trachea. It's pushing on this food. If the food has passed the uvula, then the food will be pushed back into their nasal cavity. So if it's food, it probably will be too heavy. It might not work. But if you have liquids, the liquids actually come into the person's nose and then they spit it out of their nose. It's disgusting, but it's hilarious at the same time. As mentioned, food should normally enter your esophagus because airways are blocked. You don't breathe. You can't breathe when you're swallowing. That's impossible. If you try to, you won't be able to. But if you find a way to, or manage to find a way to open that trachea at the same time as swallowing food, then your body will try to cough so that the food comes out of your trachea and back into your esophagus. Okay, so usually it just comes back up in that when that happens. Sometimes you might have a dry throat as well. Might have little bits of food nearby that tracheal opening, and that's why drinking water might bring some of that fluid down. But um, there's arguments for and against whether that really affects the digestive system or if it soothes the respiratory system more so. But we'll look at that a little bit later on. Same image if you wanted to see that. So talking about that food pipe, we call that the esophagus. This is a muscular tube. This is not your esophagus. It's behind this part here. Also, don't press on this part too tough because this is your trachea. If you press on it, it's not supposed to be touched, and it might get inflamed, and then tomorrow you'll have a sore throat. So don't play around with that. But behind it, you have your esophagus, which is a muscular tube, and it goes through the thoracic cavity straight into the diaphragm, into your abdominal cavity. That gets food to your stomach. So usually it's just folded closed, like if a balloon had no air in it. But when you're swallowing and you put a bolus into it, then you can actually slide something into it. And there's this muscular motion called peristalsis, which pushes that food along the digestive tract. You have no control over this, but as soon as food is in your esophagus, those muscles will slowly bring that down into your stomach. Um, you don't have to worry about it. That's also why if you eat food and there's a product that's slightly too big, but it's in your throat, peristalsis will naturally push it downwards unless there's like an extreme situation where that's too much effort, in which case you'll have to spit it back out. Okay, so peristalsis starts at the esophagus, but it goes throughout the rest of your digestive tract. So esophagus into your stomach, then after your stomach, it continues in the digestive tract until the food is in your rectum ready for elimination. Okay, so the whole point of that esophagus is to bring food from your mouth into your stomach. And that's a really important role when you think about it because your mouth is all the way up here and you have vital organs in this top part of your chest. You have to get that undigested food product or that barely partially digested food product into your stomach, which is way lower. So the esophagus has that entire role to deal with. Okay, so peristalsis is just a contraction on one side than the other. It's the same way you squeeze a toothpaste tube to get the toothpaste out. It's like your esophagus is doing that to get food down. At the very end of the esophagus, you have what's called a cardiac sphincter. It's called cardiac sphincter because it's very close to the same region that your heart is. And this is going to allow the food to drop from your esophagus into your stomach. If you don't open that cardiac sphincter, the food gets stuck in the esophagus, and that's not such a good situation. It's also really useful because once the food is in your stomach, there's a lot of acid in there, and you don't want that acid popping back into your esophagus. But occasionally that does happen, and when that happens, you get this burning sensation somewhere here in your upper chest, and this is what we call heartburn. So heartburn actually has nothing to do with your heart. It's just the acid eating away at your esophagus. And so you might have to eat something that's basic to calm that down, to soothe it. But it's just the burning of the acid in the esophagus there. Now, there's a couple of interesting situations where if food gets into the esophagus and it shouldn't be there, or if you eat too many products like into your stomach that your body just can't deal with, or your body recognizes a pathogen or something that's going to make it sick or it doesn't recognize, then your body, like your brain and your body, will decide that, you know what, we're not going to deal with this. We're not going to risk getting sick from this. It will cause you to throw up. So if there is something like sour milk, for example, and as soon as it gets into your mouth, you're really thirsty, or not thirsty, but you really wanted a glass of milk and you drink some milk and there's that sour taste in your mouth, but you swallowed it, immediately you feel sick. And that's a mental thing. That mental thing is causing you to feel sick, so you spit back up that milk that you put down into your stomach. So then you get this thing called reverse peristalsis, where it happens in the opposite direction, and that forces whatever went down the esophagus to come back up, and that will cause you to throw up. So you can stimulate this. If a person puts their finger in the back of their throat, for example, your body recognizes your finger as foreign, so you'll throw that up. Same thing happens if you eat something you're not supposed to. You'll typically throw that up again. So the way that the digestive tract works is there's four different layers that make each part up. You got the mucosa, submucosa, muscularis, and the serosa. The mucosa is this inner layer, and this is going to support everything behind it. It has a whole bunch of different cells that constantly secrete digestive enzymes so that your food is always digesting along the pathway. So here's a picture. I'll show this to you on every slide for this part here. But you can see the mucosa is this inner layer, and it's got a lot of bumps and folds for a lot of surface area, but that's going to have those digestive enzymes in them. Submucosa just comes after that. That's a bit of loose connective tissue, and this has some blood vessels. So the blood vessels, this is the submucosa, that's going to bring blood to your digestive tract. So you have that blood flow, that transport system connected directly to your digestive system. Then we've got what's called the muscularis. Muscularis, there's two different layers of that. So you can see that there's one layer which is circular muscle. One of them is longitudinal. Circular muscle allows you to squeeze up and down, and then the longitudinal is going to let you squeeze back and forth this way. So that allows you to have that. I'm covering up the last word here. That allows you to have that peristalsis movement. Okay. Your stomach has an additional layer too called the oblique layer, and that allows for additional three-dimensional movement to squeeze and break through foods. And lastly, you have the serosa. This is the outer layer. The serosa is keeping the outside moist and wet so that your digestive tract isn't sticking to other parts that are inside of your body, because that will cause things like friction, and you don't want that inside of your body. So it keeps everything nice and wet to slide around against each other. And that's just the outermost piece. And that brings us to the stomach. Stomach is this J-shaped organ. It's on the left side of your abdominal cavity. So find your abs and then go to the left side. That's where you're going to find your stomach. It just continues off the esophagus. So as soon as food pops into the stomach or into that region, you have your stomach. And the stomach is usually about 25 centimeters. It doesn't matter how much food is in it. It just sits there as an organ. You just got to put more foods into it. You can get different types of treatments for weight loss, for instance, or diet control. You can get rings to prevent your stomach from expanding in this diameter shape. But lengthwise, it'll almost always be approximately 25 centimeters. Obviously, this is going to change based on who you are. Like if you're a smaller person, it might be slightly smaller. If you're a bigger person, it might be slightly bigger, but it's approximately the same size. In the stomach, you have a whole bunch of these folds, which are called rugae. And as your stomach is going to expand itself, those folds disappear. So imagine balloon. I use balloons for examples all the time, so don't worry about that. Balloons, when they get old, they get all wrinkly, but if you blew into them again, those folds would go away. Same thing, those folds will disappear in the stomach. When full, your stomach typically can hold up to 4 liters of fluid. What it's going to do is receive that food from the esophagus. It's going to store food until it's ready to move on later into the digestive tract. And it's going to mix the food up with a whole bunch of digestive juices. So the stomach has some more intense ones that would typically burn us otherwise, but that food is there, or that those products are there to break down the food even better than what the rest of our digestive system could do. So that's going to move the food into our small intestine. Now your stomach is going to do both the physical and both the physical and chemical action on the food products. Your bolus is now in your stomach. So physically, your stomach is going to vibrate and shake and squeeze. That's going to physically break down the food. But then there's various chemicals in there as well. Things like gastric or stomach juices, and a couple of other components and enzymes there to break things down. So So your stomach has a whole bunch of these little holes in it. We call those gastric pits. And inside of the gastric pits, you have what are called gastric glands. We use the word gastric to identify parts of the stomach. So a quick image of what the stomach looks like, just a little cross section cut out there. And the gastric glands are going to be producing these gastric juices. And there's two different things that we're worried about here, pepsinogen and hydrochloric acid. So pepsinogen has an enzyme role to play, and hydrochloric acid is the acid that's in our stomach. There's also some mucus that is secreted. That's to keep the inside of your stomach from burning from the acid, right? If you think about it, if it's acid, it's going to burn through the material. Why doesn't it burn through the stomach? It's because of the mucus layer. So we've got first chief cells. Chief cells are going to secrete this pepsinogen that is going to be become the enzyme pepsin once it reacts with HCl. Pepsin is really difficult to make, but it's pretty easy to make pepsinogen for our body. So our body's going to produce pepsinogen, and then the acid in our stomach is going to convert that into pepsin. The HCl, the hydrochloric acid, is produced by what are called parietal cells. Those are also located in your stomach, and that gives your stomach an acidity with a pH of approximately 2. Water is neutral at 7, and so the most acidic you can get on an organic scale is 0. So 2 is very, very acidic. Like that would burn through pretty much anything. So this is good because you can even eat foods with bacteria or pathogens on them, and the acid will kill those bacteria and pathogens. Some organisms, some animals have higher acidity in their stomach, so they can break down even more dangerous things. That's why dogs can eat almost anything. But our stomach is at about a 2. So most things, not everything, but most things we can kill them if they end up into our system, unless they are like really robust and really strong. If that's the case, then we're likely going to get sick from the compounds that get there. So the HCl doesn't actually digest the food. It helps break down different parts that are in the food. So if you have things like connective tissues, or if you're eating meats, it's going to break down that connective tissue so that then we can actually digest it. It also activates pepsin. So it converts that pepsinogen to pepsin, which can be useful to us. The mucus comes out of mucus cells. The mucus cells are going to protect the stomach lining. Okay, so this is a quick zoomed in image, a microscope image of part of the stomach. You can see there's a pit here. That's for a gastric pit. And then there's cells inside the pit that are going to secrete the mucus. And if you go even deeper in, you're going to find the parietal and the chief cells that release the enzyme further in, and those just leach out. And this would be looking like a smooth layer if you saw it with your eyes, but with a microscope, it gets very, very detailed. Now, there's a couple of issues that happens with our stomach. That HCl, sometimes if there's too much of it or if it's too acidic, will break down, or maybe you're not producing enough mucus. It'll break down that mucus layer. And if it breaks down the mucus layer, your stomach is fair game and it'll actually start to eat away at your stomach. We call that an ulcer. And you get ulcers in a variety of different areas. It's a sore that happens in the wall of a tissue. So it happens through gradual disintegration because of the acid that's there. Now, it looks like most ulcers happen because of bacterial infections that prevent mucus cells from producing mucus. If mucus cells are unable to produce mucus, your acids will start to burn away at different parts of your digestive tract. In particular, you got your esophagus. If the acid splashes into your esophagus, ignore that there. In particular, there's your esophagus. If acid splashes into your esophagus, that can cause an ulcer up here. It could cause damage in your stomach itself, or even into your intestine. It can cause some damage there. There's some foods you can eat as well that can influence that. If you're not a person that eats spicy food on the regular basis, consuming too many spicy foods could increase the odds of you having an ulcer because your stomach isn't used to having that much acid in there. And the spice in spicy foods comes from an acid as well. Now, let's say the food gets through your stomach. If it gets past your stomach, it's no longer a bolus because now it's mixed in with all that gastric juice. So we call it chyme at this point. So chyme is like this pasty, soupy liquid. It's really gross, but it's now it's a goopy liquid. It's not like a bumpy bolus anymore. It's a goopy liquid, and that makes it easier for that chyme to go through our next pyloric sphincter into our small intestine. And that brings us to the small intestine. Now, we're getting a little bit too into content here. So we're going to take a pause and we'll come back in the next part and look at the small intestine, a couple of other parts of the digestive tract as well. But we'll pause here for now and pick up on things on the next lesson.